George Michael and Michael Jackson, a golf course, a plastic surgeon, and a prosecutor turned defense lawyer. All are in the news, in the justice system, and in the show coming up right now. I'm Catherine Crier. Thanks for joining me. Well, we've all heard of medical horror stories, but not many are as horrific as the botched fat removal surgery that cost Barbara Rojas her life. Prosecutors say an unlicensed doctor recklessly performed the invasive surgery in her own home and knew the conditions were dangerous enough to cause her death. The defense says that Guillermo Falconi has taken responsibility for his actions, but he should not be charged with murder. Well, joining us, criminal defense attorney Jonna Philbor and Dr. Bruce Katz, director of the Juva Skin and Laser Center in Manhattan. By phone, the detective who investigated the incident, Stephen Brownell from the San Bernardino Sheriff's Office. Detective, let me start with you. You walked into this scene. What did it look like?
Well, actually, Catherine, I didn't arrive at the scene till the next morning.
Okay.
The officers that arrived that evening took an initial report, also, along with the firefighters. And we were called out to do a subsequent investigation.
Right. Tell me what you walked into.
Actually, the next day I walked into Rosalie attempting to clean the areas that the surgery had been performed on. She was actually using bleach and had bleached a large portion of the mattress where her mother had laid for several hours, bleeding, and a couple of areas on the carpet and her clothing, those types of things. It was quite a sight.
You talk about laying on the bed. This is surgery performed in the home. What were the conditions in the home? Not to say they weren't keeping house, but this is still, anybody's house has dust and other things. Compare this to what you would expect a sterile operating room to look like.
Well, obviously, it had nothing that resembled any type of an operating environment. It was a typical, middle-class American bedroom. Queen-size bed, furniture, and then there was a small bathroom, which was attached to the bedroom in that particular area. Carpeted flooring, and it did appear to be a well-kept, home, but of course it's not a sterile surgery environment.
So you had a chance to interview Rosalie. I assume she was pretty upset.
Absolutely, yeah, absolutely. At that time, we were, Mom had been taken to the hospital, and her condition, fully was not known at that point. She was very upset, but she was able to give us the information in regards to how the surgery was performed, who the surgery was performed by, etc.
All right, I want to go to a soundbite real quickly, and this is during her testimony. The prosecution is asking her to describe the doctor and the surgery. Let's listen.
He asked me if I had dogs, and I said yes, and he said, well, you could give this to them for their dinner.
Okay. And what was he referring to when he said that?
To the meat that he was cutting off my mom.
Oh, jeez. Detective, did she give you that sort of description in your interviews?
Well, in the original interviews, obviously she was still upset and very concerned about her mother, who was still alive at the time. We didn't get into those types of matters. She described the surgery to us and actually directed us to some garage or some cans out in the garage where he had basically thrown away all of the tissue that was removed and the surgical type equipment that he used, bandages, etc. During our initial conversations with her. Later on, as time went on, and it's not unusual for victims, people in her situation, to recall additional events as it goes on.
Well, you also went and talked to Guillermo Falconi. What was his reaction? Did he seem upset?
Dr. Falconi, he was upset. I think he was upset for for a couple of reasons. Obviously at the point when we were talking to him, he realized probably how serious it was. Rosalie's mother, Barbara Rojas, was still alive at the time, but I'm sure that he now, understood the full ramifications of what he had done. He was concerned for her, but I think also concerned for himself at that point.
Did he make any statements at that point in time, explaining himself during your investigation?
Yeah, absolutely. One of the things I did note, and I know that I was asked this on the stand, was he cooperative? And he was very cooperative with us, and I think that genuinely he was concerned, like I said, both for Mrs. Rojas and himself. I think that he just had made, a poor decision. Unfortunately, it wasn't the first time that he had done this. We had learned subsequent to that there were other people that he had performed surgery on in the state of California, in our area, and I think that he should have probably understood that, or at least been aware of the consequences, and that's why he's where he's at.
Absolutely. Well, I would think so, Dr. Katz. I think anyone, whether they're from another country or not, would know you need to be licensed to practice medicine in a given location. But how can he be so worried? Maybe, yes, he was. But he wasn't visiting. He wasn't responding quickly when the phone calls were made to him. And this woman could potentially be bleeding to death.
Oh, I think that's a very serious issue. The fact that someone who's in a position of having done surgery on a patient should be responsive right away, should be at the patient's bedside if there's a serious complication, and certainly brought the patient to the hospital if he can deal with it where she was.
Would this be normally a walk-in, walk-out procedure?
It seems like this could have been a situation where it's done in an outpatient setting in the doctor's office, and then the patient goes home after. But this would have been done under a sterile technique, with proper bandages used so that the patient would not have had the possibility of bleeding like this.
Because he's sort of claiming, well, yes, I know I wasn't licensed here, but I knew how to perform this sort of thing, and I did that appropriately. Did he?
I would think not. It doesn't sound like he really was qualified to do this type of surgery, and certainly to be doing it the way he did in a patient's bedroom smacks mostly of a fraudulent type of situation.
No, I just find it horrific to imagine. How risky a surgery is this normally?
It's not terribly risky. It's basically just excising the skin and then closing the wound with stitches. But to cause a situation where someone bled away half of their blood volume, you'd have to be very inept at what you're doing.
Well, John, the question, though, and certainly the defense is, wait a minute, I didn't intend to kill anybody. I intended to come in and perform. Yes, it shouldn't have been done in the home, et cetera, but I didn't intend to kill this woman.
And that's the only argument this doctor has. And my question for the case, basically, is why was this charged as murder versus manslaughter?
Well, second degree.
Second-degree murder, but still, that implies that you have to have malice. Second degree, you have to have implied malice. Whereas manslaughter, particularly involuntary manslaughter, but there's no intent to kill, there's no malice, but you're acting so recklessly that you cause the death of someone, to me, fits squarely within these facts. Now, maybe the prosecutors decide what they're going to charge anybody with. So perhaps the fact that this doctor made the food reference, that he came to the person's house, that he performed the surgery in front of his 14-year-old daughter and took zero precautions, that probably puts them over the top as far as the charging.
I would buy that, because it's one thing to be reckless. That is, to me, that is beyond reckless. I don't think any good doctor, especially a surgeon, would undertake these sorts of things under those conditions.
Absolutely not. But then again, not that I'm blaming the victim. This was a horrific crime. But let's look at the victim. She's probably average or above average intelligence. The doctor walks in and starts slicing you open on your bed in front of your kid with no sterile equipment. When do you say, you know what, this is not a good idea anymore. Forget it. Leave. I'm going to go to a real doctor and get this done right or not get it done at all. Why didn't she make that decision?
But they have really gone after the victim and Rosalie. Good tactic?
No.
Yeah.
Not Rosalie, she's an innocent 14, now 15-year-old kid. Her testimony is going to come across as credible, and it should come across. She's not trying to lie. Her mother's dead. She was the only witness, really.
But what about the sort of intervening causation that everybody's saying, wait a minute, if you've just taken her to the hospital, if you've done this quickly,
call 911 earlier.
Exactly.
And that may come more into play in a civil context if Rosalie's trying to get money under a wrongful death claim. As far as the criminal case, it doesn't have much to do with it. We need to look at what was going on in the doctor's mind. What was his scienter? What was his intent? What did not do to act recklessly or not act recklessly? And not focus so much on Rosalie's conduct.
You've got some recommendations, doctor, if people are considering any sort of plastic surgery, this sort of thing. What are they?
Well, first of all, we suggest that anyone who does a type of surgery like this is board certified, either in dermatology or plastic surgery, and very importantly also has experience doing the procedure. There are board certified physicians that don't necessarily do liposuction or brachioplasty like this.
So we have the graphic up there. You would want to know how many procedures that you are seeking that particular individual had done.
That particular doctor, yes. How many procedures do they do on a regular basis? Look at before and after photos. And also ask about referrals from doctors and from patients. Speak to doctors who refer to this surgeon and to patients who've had the procedure done.
And obviously, you don't do this at home. Detective Brownell, Dr. Katz, and Jonas Billboard, thanks very much.